Okay, what is going to happen later is we're going to have Dr. Priya from the Ministry of Health. She's going to talk to us about vaccines, boosters, and beyond. All right, Dr. Priya will be coming in shortly for that talk. And after that, in about 45 minutes time, we'll have a representative, Ms. Balvinda Kaur. Ms. Balvinda Kaur from Homage Care Services, and she will be sharing with us her take on caregiving services from her organization, Homage. All right, so stay tuned for Balvinda Kaur roughly about 11:15 after Dr. Priya's session. So back to the housekeeping, folks. Kindly mute your microphones right now because the test session has begun. We want all microphones to be muted. A short reminder again, the lucky draw is in the chat box provided. Please click 15 wonderfully crafted Homage t-shirts will be given away for 15 randomly selected winners at the end of the webinar today. Okay, and we will inform all winners based on the contact details provided. You can fill in your details during the session and by the end of the session, no issue. All right, if you have any problems, folks, just WhatsApp us. Okay, good luck.
Derek, right. That's not the only lucky draw we're giving out, right?
Yeah. That's right. Actually, I'm putting everyone in suspense. We are also giving away 2 invite passes, folks. 2 invite passes to a reunion Chinese New Year dinner and performance at Berjaya Times Square on January 29, brought to you by none other than us, the amazing seniors and the Giving Bank. 2 invite passes from amazing seniors and the Giving Bank for 2 lucky winners today. All right, this is for dinner and a performance on January 29. So stay tuned, folks, and please register yourself today in this webinar chat forum. All right, now let's move on. Okay, I would like to just give a quick kudos to the founders of Amazing Seniors, Ms. Jasmine Amirul and Penny Lau. These are the 2 wonderful ladies and the key brains behind Amazing Seniors. We are so grateful for them. They are here together with all of us here, Ms. Jasmine Amirul and Penny Lau. And without further ado, all right, I would like to pass the session over now to Penny, all right, to give a quick and short and sweet and lovely take about Amazing Seniors. Over to you, Pen.
Hi, good morning. You guys can hear myself, can hear me? All right, you can all hear me? Give me a thumbs up. All right, cool. A very, very good morning to all of you lovely, amazing seniors out there. Thank you for joining us once again as on our live webinars. We're going to be doing a lot more of this over the next few weeks. In fact, over the next few months, we have got a whole lineup of interesting things prepared for you throughout this whole entire year. Now, for those of you who are new to us, welcome. This is your first live webinar with us. We, of course, hope that you will enjoy it and bring more friends to join us. Now, on this platform, let me just tell you a little bit more about Amazing Seniors as a platform. We are a platform that is special because we specifically cater to seniors aged 50 and over. Yes, life begins at 50. Now, we want to create a safe community for all seniors to interact with each other, to learn from each other, and more important above everything else is a platform for all of us to have fun in. And as such, we focus on bringing you deals, event information that has been specially curated for all of us seniors. Okay, because we sure do want to celebrate life begins at 50. Now, without further ado, I would like to introduce today's speaker, who is going to tell you a little bit more about I think we've heard enough about COVID-19. We just want to get rid of it now. But we want this speaker to explain a little bit more and tell us more about the vaccinations. I actually also had a discussion with her. She's a personal friend of mine, also my someone I grew up with. She's my classmate, and she's going to share with us about COVID-19, boosters, moving beyond boosters, just, all those questions like how many boosters and all, I think it's time for you to ask her. So anyway, let me just tell you a little bit more about her. If I have to, well, kind of like, when I look at her credentials, I think it's going to, I'm going to eat up into at least about 15 minutes of my time, of your time, to explain, to just describe who and what she is. But in any case, let me just introduce her. Dr. Priya Raghunath is a fellow of the Faculty of Occupational Medicine, Royal College of Physicians, Ireland. She's a public health physician as well as occupational physician, and she's currently the head of occupational and environmental health sector in the Ministry of Health, Malaysia. Dr. Priya is also the chairman of the Society of Occupational and Environmental Medicine under the Malaysian Medical Association, as well as the president of the Society of Occupational Physicians. She has served in the Ministry of Health, Malaysia, for over 20 years and has been involved in occupational health for more than half of her service. She has participated in various international and national collaborations with various public and private agencies, and is also involved in the development of numerous guidelines pertaining to occupational health in the Ministry of Health. Dr. Priya is a committee member of the National Council of Occupational Safety and Health, as well as the chairman of the Bureau of Occupational Health under NCOSH. She's a committee member of the Industrial Standard Committee of Occupational Safety and Health, Department of Standards, Malaysia, and also serves as the committee member of the Ex Gratia Compensation Committee, Ministry of Finance, Royal Malaysian Police, and the Social Security Organization Appellate Board. She's also a technical working group committee member for the International Organization for Standardization, Geneva, of the Global Chemical Health Network, WHO. And currently, she is the focal point of occupational health for Malaysia in the Asian Cluster 1 group. Like I said, a bit of a mouthful there. What can I say? She is experienced, she is smart, she is intellectual, and I think I have made enough introduction for her. Dr. Priya Raghunath. Amazing seniors, please welcome her.
Thank you very much, Penny, for that extremely kind introduction. So, hi, a very good morning to all of you. And thank you very much to the amazing seniors for inviting me to give this talk. I'm really honored to be invited to give this talk. I usually give technical talks to a different group, the working population, but being part of the COVID team, I'm very happy to share with you what I can with regards to vaccination. So if you just allow me, I'll share my screen. Yes. So ladies and gentlemen, I'm just going to give you a little bit of an introduction to COVID, not the basics that you know, but just for a bit of understanding purpose on why we need to have a vaccination, what the booster is needed for, and so on. Right. So, ladies and gentlemen, the whole story started in December 2019. For us in public health, we've faced a lot of outbreaks. We've had many outbreaks over the years. We've had the Nipah virus, we've had Japanese encephalitis, you all would be aware of that. We've had SARS, we've had H1N1, H5N1, avian influenza, and so on and so forth. But all this while, all these outbreaks, ladies and gentlemen, were within Malaysia or within a certain district, within a state, within a country. So when that happens, it's just considered an outbreak in that state, just like we have a dengue outbreak in Malaysia. So just for your understanding purpose, an outbreak is something you can control at a lower level, at a smaller level and a smaller scale. The last there was a pandemic was way back in 1918, an influenza pandemic, and it's been so long, nobody even remembers it. So what had happened was in December 2019, there was an outbreak in China. It started, of course, in Wuhan, and subsequently, it started spreading to other countries. And in Malaysia, we had our first case on the 24th of January 2020. And eventually, on the 30th of January 2020, the World Health Organization declared this a public health emergency of international concern. And that's what you call a pandemic, meaning it's an epidemic of global proportions. It affects the whole world. So let me just bring you up to date on what we know till now. So a lot has been said till date. And what's important is that we understand what this is all about. So talking about COVID, there has been a lot of maybe misconceptions also on how it is spread. So just to clear the air with you all, COVID is spread by droplets, meaning the virus sits within a droplet, and a droplet can travel up to about 1 to 2 meters before it drops. And that is why we had this distancing of 1 to 2 meters, because once the droplet drops and breaks, then it's difficult for you to get the virus from it unless it's still sitting in a droplet form. However, the tinier droplets can remain in air for a longer period of time and also may travel further than the 2 meters. And that's what was meant by it is also airborne. It's not around us. Like if you step out now, it's not around you. If you're alone in the room, it's not around you. But if you're in a group or in a room with a group of people, there are a lot of people in that room, and the ventilation is not very good, then you find that the tinier droplets probably travel further, stay in the air further, and this is where you have some sort of an airborne or aerosol transmission. And the second thing is by touch. So touch is basically touching the secretions, body secretions of someone, and then touching your own mucous membrane. That means your eyes, your nose, your mouth. If you just touch it on your fingers, if you don't have a cut, it's unlikely you will get it. But the chances are people tend to, touch their nose, their mouth, and this is where the spread can occur by touch. But in essence, the general spread is through droplets. A very quick understanding about incubation. So why we have always used the 14 days is that from the time you are exposed, it takes 1 to 14 days for you to manifest the infection or get the infection if you're going to get it. If not, it just sits in you. It doesn't do anything. Right? But so that's why we had to put the period of 14 days of isolation. However, over the period of time now, we understand that the current strains and how it has evolved over time. At this particular point of time, after 5 to about 7 days, you're already non-infective, meaning you may still be positive, but you cannot spread to somebody else. So that's the important thing of that incubation period. And that's why we still do quarantine and isolation at this point of time. And if we look at estimates on clinical severity, this study was done in February 2020, but still stands good at this point of time, also according to the studies we have done and the research we've done in Malaysia. So about 82% or more than 80% of the cases are usually mild. You'll have either no symptoms or mild symptoms. About 15% will have severe symptoms. They will need hospitalization, and usually only about 3% are actually critical, meaning they go to ICU, and they also may need ventilation. And just to clear the air on symptoms, yes, there are many symptoms. It's very, very similar to other flus like fever, cough, sore throat, difficulty in breathing. And then there was this interesting symptom that came about, difficulty or inability to smell or taste. Of course, if you lose your smell, you will lose your taste, because you cannot taste without your smell. And so these are some of the symptoms faced by people. And the severe symptoms could be pneumonia, kidney failure, other organ failure. But the most important thing to note is that the vulnerable group here are the older persons, and also those with pre-existing medical conditions like high blood pressure, heart disease, lung disease, cancer, diabetes, and so on. And also a rather large number of older people do have these chronic diseases. So that places the elderly or the older group of people at a higher risk. And therefore, they being the vulnerable group need to be cared for, and they need to care for themselves as well with extra precaution. So the important thing to remember, the basic facts that we need to remember are that 1, this is a novel virus. Novel virus meaning it's a new virus. It is a coronavirus, just like SARS in 2003 and MERS-CoV in 2014. However, this particular virus is very new and different in its makeup. We find that we have to still learn about it. We have learned so much about it. We still have to learn about it. But it's also a rather stubborn virus, you can see. It does not want to be dealt with. It's mutating, it keeps changing, it keeps gaining variants. So this novel virus is something we still have a lot to learn about. So this is what makes it difficult for us to control the whole world around, not just in Malaysia. Secondly, there's no specific treatment. We know that there's no particular medication that can treat it. So many medications have come out. There was hydroxychloroquine, a lot of antibiotics. There was even the ivermectin, and people have been trying to promote a lot of this medication. But our research shows, and also by WHO, no single medication can treat COVID, but these medications are used in different ways by physicians in control setups. So it's not meant to be taken by people on their own. And I must tell you, many people have been admitted with ivermectin toxicity. There were people unfortunately thinking they were doing the right thing and popping ivermectin tablets every day. Please don't do that. We've had many cases of ivermectin toxicity. Third important thing is to remember is currently there's no sustained immunity, meaning even if someone gets a natural COVID-19 infection, they do not have long-term immunity. And I mean, when you say long-term immunity, for example, if you get an infection, you get a lifelong immunity from that. Now, for example, if it's flu, talk about influenza. Influenza gives you protection for a period of 1 year. And that is why you take your vaccination every year. But there again, you have your northern strain, southern strain, so the vaccination changes accordingly. So it only lasts for a period of 1 year. And similarly, if you take hepatitis B vaccination, those days we had to take boosters, but nowadays the hepatitis B vaccination can last you about 20 or 30 years. And last but not least is preventive measures. Preventive measures is the only way for us to prevent COVID. Part of the preventive measures is just taking your vaccination, but at this point of time, we cannot give up the other preventive measures like social distancing, wearing the mask, and so on. Okay, let me now just share with you some statistics. So if you look at the COVID-19 trend till now, and this is a situation by the WHO region. So the World Health Organization divides us into regions, and we in Malaysia sit in the Western Pacific region, where there's 13.8 million cases at this point of time. So it doesn't look like a lot compared to the 106 million in Europe or 124 million in the Americas, but for us in the Western Pacific, this is a very large number. And we also do need to understand in the Western Pacific region, our capacity to cope with the cases, to manage the cases is also much less than what is there in the Europe and the Americas. So having said that, this is still a large number to deal with. And if I can just share the Malaysian statistics, as of the 21st of January, okay, basically you can see that we've had 4,046 cases on the day. Now the cases are going up and down from 2,000, 3,000, 4,000. And you can see that it's somewhat on the rise as well, given the fact that now we have a new variant, I'll talk about it, which is Omicron. We are not really stabilizing yet. We are stabilizing to a certain extent, but you do still see that we have some spikes. But what is so important, ladies and gentlemen, is from the time we started in 2000 and end of 2019, early 2020, we note that 83% of the cases are now on home quarantine. Previously, we had to put everyone in quarantine, everyone in hospital. Then we had quarantine centers, designated quarantine centers. And now we can put people on home quarantine. And I'm talking about positive cases. It's actually isolation at home. And that's an amazing thing. And if you look at the ICU per se, only 0.2% of the cases are in ICU and only 0.2% of them are ventilated. And that is a very, very important thing to note. And that has actually come about because of our vaccination program. So if I may share with you that from the 25th of January 2020 until the 12th of January 2022, we've had 2.7 million positive cases. So this is just a period of time that I'm sharing with you. And from the 2.7 million positive cases, 11.5% or 321.8 thousand were actually among the elderly. And from that 321.8 thousand, 7.4% actually resulted in mortality or death. That's about 23,780 of the elderly. So as I said, that's the vulnerable group. And so we're extremely concerned about this vulnerable group. So just to share a little bit also on the adverse events following immunization. So if we were to look at some analysis that we did on the adverse events until 29th of October 2021. So we note that this research was actually done by one of our research institutes, and it was found that 19.5 per 1,000 doses resulted in mild adverse events, whereas 0.03 per 1,000 doses resulted in severe events. So severe events are very, very, very rare. Okay, and it also depends on the person. It also depends on their bodily makeup, and it also depends on how they are, you know, your current situation, your health situation at that point of time. The overall public health response to pandemic, if I may just share with you, it's not for you to try and understand this graph, but just to let you know that we've had three waves of pandemic. You know that, 3 waves of outbreaks in Malaysia. The first wave was from the 25th of January 2020 to 16th of February. And this actually was a group of tourists in Malaysia. There were no locals or Malaysians within that group. And after a gap of 11 days with no cases, then we had a second wave whereby that was from the 27th of February to the 8th of July 2020. And that was the biggest wave that we had. And subsequently, we had a third wave. But you will notice, I'm just showing you the second wave. So we still had cases from outside. The red are the imported cases. That means cases coming in from out of Malaysia. And the rest were local cases. And if you see, a large number were within the citizens of Malaysia, that's in green. And of course, a certain number of non-citizens in Malaysia, and that's in yellow. And just going on to the next year, and just to show you, we had a lot of interventions put in and MCOs lockdown. People, that's the part that actually affected people greatly and gravely. But unfortunately, it was a very necessary action to be taken, not just by Malaysia, but by many countries in order to control the infection. And why that was done is basically for this, you all would have heard flattening the curve. What is meant by flattening the curve is, if you don't try to manage it, you'll have too many people getting positive at one period of time. So you'll see that big curve on the left, the orange curve, and you see that means too many cases being infected. And when you have too many cases being infected, you overwhelm the hospitals. And we do not want to have an Italy. You all know what happened in Italy. Many people were just passing away as they were because they could not get treatment. They could not get treated or managed in the healthcare facilities. And that was something we learned from, and we really did not want that. So the idea was to have less number of people infected at one period of time. And hence that led to us having lockdowns. That means preventing people from mixing with others so that we slow down the spread, right? We spread it out over a longer period of time, and hopefully it will settle by then. So let me then come to the next thing on what's the fuss about variants, right? We first started with COVID-19. We said the first variant was there. There was the China variant. And then, we called it the China strain. There was the America strain. There was the Europe strain. In Malaysia, we had the strain. Then, we had our Sivaganga strain. We called it the D614. Everyone, talked about it just like the durians. We had all these D strains. And then we had subsequently so many strains. So you can see, like I said, this virus is very stubborn. It just doesn't want to go off. So viruses, when they try to survive, they mutate. They mutate so that your medication doesn't work, your body, doesn't fight it as easily as before. So variants actually occurred also in COVID-19, as you're very much and well aware. And the two things that we have are what we call variants of interest and variants of concern. We've heard this a lot. So the variants of interest are basically those variants with genetic changes. They are known to affect the characteristics, like it make the virus more transmissible, make the disease more severe, and can cause community transmission. So this variant of interest may be in one particular country, for example. But when this variant of interest becomes so big that it goes at a larger degree, a global scale, it goes from country to country, you find it in other countries as well. Then they designated it as the variant of concern. That's what VOC was all about, where it may either spread faster or it become more severe and so on. And there were a few variants of concern that WHO actually has noted. We had the alpha, beta, gamma, delta, omicron. I know I've put the countries there, but the country only means that that's where it was first identified or isolated, doesn't mean that it came from that country. That's also a little bit of a misconception. But of all these alpha, beta, gamma, at one time we had alpha and beta a lot in Malaysia. But what we found is that delta was very severe. It spread more easily, but we also found that there were more severe symptoms and more severe cases from Delta. And just when we thought things were getting better, and then Omicron comes in, and Omicron comes to give us a different side of things. Now, the difference with Omicron, which I will explain to you, is that it spreads more easily. So if I may touch a little bit on Omicron per se. So Omicron is the latest variant that we have now. And the difference is that Omicron has many mutations. So we don't have to go and talk about spike proteins and all that. That's too technical. The important thing to remember is that it spreads very quickly, although it is not as severe. So if you look at the little graph down there, in red, you can see Delta. The severity is on the left, right? That's on your y-axis. So it shows that Delta can be very severe, but it doesn't spread as much. And Omicron in blue spreads vastly, spreads easily, but is not so severe. And at the end of the day, it's back to the preventive measures at this point of time to reduce the risk of Delta and Omicron, which are your physical distancing, wearing a well-fitting mask, having good ventilation, avoiding crowded spaces and poorly ventilated spaces, especially for the elderly, keeping up with your hand hygiene, your cough etiquette, and getting vaccinated when your turn has come up. So these are very important things that still hold good at this point of time. So why vaccination, right? Then everyone said, oh, this is a political thing, or this is the drug companies' rules, to make money. Then, okay, first it's 1 dose, then it's 2 doses, then it's 3 doses, and what next? So we know that initially we thought things were getting better, and then poof, we get hit with the second wave, right? So, and then vaccines come out. So there are many questions being asked. Are these vaccines believable? Can we believe in them? Will they work? Are they effective? And how come you got a vaccine in such a short period of time? Well, usually, yes, it takes a few years to develop vaccines. However, now there are some new technology whereby vaccines can be developed much faster. And at the same time, WHO had no choice, because this is a pandemic level or a global level infection. It's something that we need to take care of in the whole world. It's not just in Malaysia. So we had to come out with some vaccine to help us gain some immunity, because we must remember the different countries will react differently, will take care of the people differently, they may be affected differently, and therefore it was imperative to have some protection out, because not every country was actually following the distancing or could follow masking and so on. And when this vaccine was brought about, it was brought about after extensive research. And even after the vaccines were given, or we started giving vaccination, research was still being carried out. We did our own research as well. We don't just depend on WHO or the other countries, but every country also does their own research. And we only started administering the vaccine after our research was also complete. I won't say complete, but carried out, and we had some results. So you all are very well aware of this, the MySejahtera and the vaccination certs. And now once you've got your vaccinations, it will come out in your MySejahtera. You will have your first dose, you will have the second dose, and even your booster dose will pop up. And vaccination has been used as a means of weeding people out. For example, you can't go to the restaurant unless you're fully vaccinated, or certain places they will check on entry. Those are the entry requirements. And why? I'm just sharing this again, not to get very technical, but just a quick share. I'm sorry, the slides are actually in Bahasa because these are our official slides, so I could only change the title. So just a quick share to show you. If you look at the three lines over there, you'll see that the line in green are actually deaths of those within or among those fully vaccinated. Fully vaccinated meaning those who had received 2 doses. If it was a 2-dose vaccine like Pfizer or AZ, or those who received 1 dose in a single-dose vaccine. And then you will see the purple line was deaths among those who didn't complete the vaccination. Maybe they only took 1 dose in a 2-dose vaccine, or they didn't take any vaccination. And the last was the deaths among those unvaccinated, which is the red line. So you can notice that initially it was all the deaths among the unvaccinated that were very high, and you can see the gap between those unvaccinated deaths and the vaccinated deaths. It's really a huge gap, meaning vaccination really helped. But after a period of time, you notice that, hey, how come it's dropping? And now you do see a rise in cases among the vaccinated. This is when, of course, we had Delta coming in and then Omicron coming in. But most important, those vaccinated, their immunity status started waning. The immunity level started waning or dropping because they had been vaccinated for more than 3 months, 3-4 months, even up to 6 months. Okay, so there's a lot of variability on the 3 months, 4 months, 6 months. But the important thing we know is after that 3-4 months, it starts coming down. So once that level in the body starts coming down, then we start seeing deaths and severity also increasing. So, of course, a lot of questions come about. It's a new vaccine. Is it efficacious, right? Will it work? Is it safe? It's a toxin after all. Are there any side effects? How long will the immunity last? So what we do know now is that, yes, when we first started the vaccination program, it actually helped to reduce the number of cases. It reduced the number of cases quite well. But as I said, there's a lot of mutations going on. And at this point of time, the important thing about the vaccine is that it reduces the severity of the disease. So when you get the vaccine and if you were exposed to COVID and you get a COVID infection, chances are either you will have no symptoms or very mild symptoms, and you won't go towards that very severe cases of having to be admitted or having to go into the ICU and get ventilated. So that is the very important part of taking the vaccine, and especially more so in the elderly community. So this lack of vaccine confidence has been there from the 1800s. You know, they thought that if you take a cowpox inoculation, the patients turn into cows. I mean, this is a misconception, and it's human nature, right? It's something that we do understand. And you can see that even there was a anti-vaccine advocacy way back then in 1955 about the Salk vaccine, that's the polio vaccine. In 1853, they started saying that, oh, children are dying from vaccines, but actually, it's because people don't understand it. And yes, if you have an allergic reaction, you can succumb. And that's for any vaccine, not just COVID vaccine. But allergies are very rare. So importantly, we have a desire to get back to normal life. So we need to trust in the vaccines and the scientific process. Because I assure you a few things, the numbers that we report are very authentic. We don't fix the numbers, as people have been saying so. And whatever we do is based on research. That also I can tell you. It's not based on whether the drug company promotes it or anybody promotes it. We actually base it on the research that we have done, and we are still going on and carrying on at this point of time. However, there's anti-vaccine movements and a lot of negative messages are sent around. There's even a lot of fake messages being sent around. It's not only people from various socioeconomic status are facing this. There have been even social experiments, people going to the restaurant, purposely removing their masks. I mean, I don't really get, and we don't really get what people are trying to do, but we hope, that people understand the reasons for it. And at this point of time, something very sad going around is anybody who passes away, the next day a message will go, oh, this person took their booster vaccine 5 days ago, 3 days ago, and that's why it resulted in death. Even with Shabby, you all would have known, our sports announcer Shabby. And even on a personal note, it happened to my very own nephew, who passed away from a heart attack. But the next day, the message went around, hey, he had his booster a few days ago. So we have to be very cautious about what we get on the WhatsApp and what news we get. We always must question and try to understand, try to go for authentic sites and verify whatever information you get, and understand that the ministry is actually providing a lot of information. If you're on the Telegram and you follow it daily, the MKN Telegram, you will actually understand a lot of what is going on, because we're being rather transparent with some of our researchers. The data is also out there. We have a COVID Now site which has the data, and for those who are interested, maybe yourselves or your family members, you're always welcome to check the data. And this is the other thing that we are very concerned of. It's about fake vaccination certificates. So many people, because they know they can't go to restaurants and they can't do certain things, and unfortunately, due to some unscrupulous medical practitioners, some fake vaccine certificates were being produced. When we say fake, meaning the doctor fakely entered the information that this person was vaccinated, and so the MySejahtera produced the vaccine. It's not that they produced the cert that way. And so I think these doctors are being taken to task. Unfortunately, there's always some black sheep everywhere. But our concern is these people who are unvaccinated with fake vaccination certs going everywhere, and if they do not adhere to other preventive measures, they are susceptible to get it. And when they are susceptible to get it, they can also spread to others. So this is our concern. So importantly, as Penny had so rightfully put it in the beginning of her talk and during her introduction, our vaccination is towards a global herd immunity. So what is a herd immunity? In a normal epidemiological sense, if there is an outbreak, a small outbreak of a disease, we say that if we can vaccinate at least more than 80% of the population, it covers the whole population, because it is assumed that 20% are people who are pregnant at a point of time, or are underaged, or can't get the vaccination, or who have an illness that causes them not to be able to take the vaccination. Then in normal circumstances, epidemiologically, this should work to give one a herd immunity. But because this is a pandemic, meaning it covers the whole world, we cannot quickly say Malaysia has achieved herd immunity. And we will never be able to say that because our borders are open. So we have people moving in and moving out. So only until the whole world reaches global herd immunity, then we can go into an endemic phase. So that's the hard part. So the faster we do this, the faster we manage it, take our vaccines and try to reduce that prevalence of this disease, the occurrence of the disease in our community and in all the communities around the world. That's when we actually get back to normal, and WHO will actually be the one to announce endemicity. Anyhow, having said that, let me just share with you on antibody levels. Now, after a COVID-19 infection, as I mentioned, initially when you get infected, you'll see that the immune response is very high. And then after a period of time, it just starts waning. After 6 months, it's already down, right? And similarly, so we want to make sure that the immunization addresses that. So therefore, you can see that when you give a vaccination, say 1 dose, the initial dose produces the blue peak, which is your peak antibody production from the 1 dose. But
sorry, Dr. Priya. Sorry, yes. Dr. Priya. I'm just going to interrupt you for this moment. Sure. Amazing seniors, please don't steal the limelight away from Dr. Priya here. Please kindly mute and stay muted until the end of the session. I know you're excited. You want to ask her a lot of questions, but hang on. Put the questions in the chat group, or you can talk to her after this. Okay, we will be giving you an opportunity to speak with her. But for now, please stay muted. Please stay muted. Or I can organize a session for you guys to speak after that too. Okay, carry on, Dr. Priya. Sorry. This was an interesting part.
Not at all. Thank you very much, Penny. Yeah. Yes. So going on from that, why we need 2 doses? Because you can see the first dose gives you a peak production, but the second dose increases the antibody level. So it gives you an optimum level of protection. And that's why you need 2 doses. But of course, there was a single dose vaccine as well. But in that particular vaccine, the single dose would give you that level of vaccination. So all we're saying is if it's a 2-dose vaccine, you must take the 2 doses. And not just taking the doses, the period of time after the doses are very important. If it's a 2-dose vaccine, you have to wait for 14 days after the second dose to be completely vaccinated. However, in a single-dose vaccine, you need to wait for a period of 28 days after that dose to be considered fully vaccinated. So these are little things that sometimes may not be understood as well, and you get confused when you're asked about it. But having said that, we know now that peak antibody level also does go down, even with vaccination. So just to show you a little bit more statistic, just a quick one. If you look at the vaccine effectiveness against infection over time in adults over 18 years of age, you can see that after 4 to 5 months, it's coming down. These are a few studies that were carried out among different groups, frontliners, nursing home residents, and so on. And you can see that that effectiveness reduces. And of course, looking at hospitalization, it also reduces to a certain extent, but the hospitalization will increase because as the resistance or the vaccination and immunity wanes and comes down, then the hospitalization starts going up. So this is the reason why we realized there was a need, or there still is a need, for this booster vaccine to be given. So what does the booster do? It boosts your immunization. For example, hepatitis B vaccination. Those days when we took a hepatitis B vaccination, those of us in medical school, we had to take. So we had 3 doses. Hepatitis B is 3 doses, a preventive, 1 dose, second dose after a month, and third dose after 6 months. But subsequently, we had to take a 5-yearly booster just to keep the immunity level high. But currently, hepatitis B vaccines have progressed over the years, and the current vaccines, if you take your 3 doses, you have some 20, 30 years of protection. So you see things also evolve. But at this point of time for the COVID vaccine, we do need to have a booster, because even the natural immunity from a vaccine, from an infection, is not prolonged. So what less the booster? Can you imagine that the booster can also prolong your immunity? No. The booster, I'm sorry, I apologize. The vaccination can give you prolonged immunity? No. Because the vaccination works just like the natural immunity. If the natural immunity cannot give you prolonged immunization, at this point of time, the vaccination cannot give you prolonged immunization. And therefore, there is the need for this booster dose to be taken. And if you notice, we targeted that the booster dose should go to the elderly, the vulnerable population first. So again, when we look at some data from the UK on a breakthrough infection. So what breakthrough infections are, or what it means is that once you have some immunity level, you assume that you will not get an infection for a few months. However, some people will also get an infection once again, even though from natural immunity, right? Or even though vaccinated. And we found that if you look at the Delta, right? The breakthrough infections in the Delta, and then we compared it with the breakthrough infections in Omicron. Of course, you can see that the breakthrough infections in Omicron is more. However, importantly, after the vaccination, you find that breakthrough infections reduce in both, right? In Delta and also in Omicron. So it brings the Omicron levels closer to Delta. So that's what we're looking at after this. And what they did share with us is that originally, if you take the 2 doses here, we're talking about Pfizer, you can see the antibody levels in Omicron is much less compared to the original virus. However, with that additional dose, right, you find that it goes 25 times more. And that's what we need. But then, of course, having said that, then we'll come to the question later of how many boosters. Okay, that was asked earlier. I'm sure you all are going to want to know that. And the answer really is we don't know, because we've gone for the 3rd booster. We're not sure if we can go for the 4th booster. But having said that, the booster alone cannot be our mechanism forward and our strategy forward, because what are we going to tell everyone? You have to take a booster every few months. That's not viable, that's not feasible economically and also socially. So even in WHO, in the world level, they're thinking about it. What can we do next? How can we come to make this virus prevalent in the whole world so that we don't need to depend anymore on a vaccine, we don't need to depend anymore on preventive measures? Of course, the easiest thing would be to let loose, tell everybody, fine, open up your mask, let's infect everybody. But the danger is if you do that, we think you can say, oh, maybe this might, get everybody infected and they're done with. But again, we know once you're infected, your immunity goes on and you can get infected again. And we do not want there to be at a certain point of time, that many admissions, that many deaths. We can't be responsible for that. And we don't want to see people succumbing to the disease. So if we look at our vaccination achievement up to now, 78.7% of the population has already received 2 doses. 97.9% of the adult population has received 2 doses, and 88.3% of adolescents have achieved 2 doses. And I must say, the vaccination program went off very well. And thank you to everybody out there who played a role. It's not just the practitioners in the government, the practitioners in the private sector, the volunteers who came to help with the PPVs. Everyone made it happen. You know, we were one of the countries that achieved our higher vaccination rate very, very quickly, and a warm thank you to everybody for that. But unfortunately, and then, you know, we see that the levels started waning, and then now we have to go for a booster. So that's the need and the requirement for the booster, and that's very, very important. And if I may share with you that up till the 12th of January 2022, we find that 3.3 million, or 95.1% of the elderly, completed 2 doses of COVID-19 vaccines. The ministry had visited 1,023 elderly care homes, and from those homes, 19.6 thousand and 10 elderly and 10.1 thousand staff had actually completed their 2 doses, and about 2.029 million doses, or elderly people, sorry, which was 57.9%, have actually taken their booster doses. We are pending 1.4 million elderly to take this booster dose. So this is just to show, you know, that in the rollout of the vaccines, I must say, elderly did come forward. Initially, there was a lot of hesitation, but we are very glad to see that eventually people came forward and took their vaccination, and which is so, so important in protecting them. So this is something that I think everyone would be extremely interested in. People are always asking, okay, I took Pfizer, do I take Pfizer? I took AZ, do I take AZ, and so on. So this is the recommendation that we have come up with. Okay, previously we said that if you had taken a Pfizer vaccination, you would take your booster after 6 months. And if you had taken Sinovac, you take the booster after 3 months. But now all this has been revised once again. So whatever vaccine you took in the primary series, irrespective of whatever vaccine you took, after 3 months, we go for the booster. At this point of time, this is our policy or our stand. And so what we say is this: if you had a primary series of Pfizer, it's recommended to take a Pfizer. If it's AZ, also we recommend to take a Pfizer, right? And Sinovac, also Pfizer. Sinopharm, also Pfizer. Moderna, it's recommended to take a Moderna. CanSino, Sputnik, and Janssen, also it's recommended to take a Pfizer. However, if worse come to the worst, you can't get a Pfizer, then some alternatives have been given, where a Pfizer can take a Moderna, AZ can take AZ, Sinovac can take AZ or Sinovac, and so on and so forth. Why we say this is, we did see some statistics that in certain vaccines, despite taking a primary dose, the protection effected was slightly less than the other vaccines. Like, for example, a Sinovac, everyone has already heard that eventually it gave a slightly lesser effectiveness. Therefore, it is recommended that those who took 2 Sinovac in their primary doses they would need to take a Pfizer in order to improve on their vaccination status. You know, and we do not know if some of these groups may need even a 4th dose anyway, because we want to make sure that their vaccination status is high. But having said that, all these policies change. It's a very dynamic situation. It's very fluid. It changes over a period of time. So something that stands good at one point of time may not stand good at the next point of time. And it's not because we're trying to, you know, hide things or make up, but because research tells us so, that things are different. So importantly, for the booster vaccination, we subsequently from February, fully vaccinated status in the My Sejahtera will be only after the booster has been taken for certain groups, that meaning those aged 60 years and above, and all the Sinovac recipients aged 18 and above. So for these 2 groups, come February, if they still haven't taken their booster, their status will revert back to incomplete vaccination. And once they get their booster, only then will they be changed to complete vaccination. Because for these groups, it is imperative that they get the booster. However, booster is also being given for other groups, such as those with underlying medical conditions, other adults on priority risk groups, as well as those living in long-term care facilities. And as I said, endemicity will come. We use the term so loosely. Endemic means living with the virus, being with the virus, like dengue. Dengue is endemic in the country. You get small outbreaks here and there, but it's there. We are not saying that we get bitten by mosquitoes, but every time we get bitten doesn't mean we get dengue. We just say be careful if you're in an area, prone to a lot of mosquito bites, or a location where dengue is prevalent. So as I said, actual endemicity will be announced by the World Health Organization, but we are aiming towards some sort of a local endemicity in Malaysia. But as long as our borders are open, it will never really be full endemicity in the country. So, and when we go towards endemicity, it's not just about vaccination. So this is just to share with you that we look at many different components in order for us to reach endemicity. We look at our daily cases. We look at the R0. You all know that R0 is the sort of spreadability rate, you could say. The R0 is 1, means one person can spread to one other person. That's what the R0 really means. We would also look at our admissions, our ICU usage, and ventilation usage. So all these are the important things that will be taken into consideration before an endemicity state is actually thought of, and it has to reach certain standard levels or standards set locally, regionally, and also globally. So if I may just touch very quickly on some definitions for senior citizens in Malaysia. So our definition in Malaysia is that a senior citizen is any individual at 60 years of age and above. And this is in line with the United Nations World Assembly on Aging in Vienna, 1982. And this is slightly older statistics. There's approximately 3.2 million senior citizens as of 2019, and the numbers are more at this point of time. And our concern is they are at a higher risk of getting COVID-19 and more serious complications. So the impact of COVID-19 on the senior citizens is vast. It has led to so many things. There's an economic impact. Many people really couldn't manage themselves, or they had no money, they had no income. They may have been neglected, abused, they face mental health problems. They are also the exposed group if nobody was actually taking the trouble to manage them. And lastly, it could lead to mortality or death in that group. And of course, that's a really terrible thing to face, especially as a senior citizen. So the responsibility of family or caregivers would actually be to constantly practice precautions to avoid potential spread. So we always feel, oh, we go and see the elderly, we hug them, we kiss them, but that's wrong. If you really love them, don't hug them and kiss them, because you could spread. You think, oh, it's only me, I'm only your daughter, I'm only your son, but you are going out. You may be going and eating in a restaurant, So unwittingly, we think, oh, we are loving them, and we have to explain to them as well. If we don't hug you, it's because not that because we don't love you or don't care for you, but we don't want to spread to you. So that communication also needs to be there. Ensure sufficient requirements, food, medication, ensure that they get treatment if they are ill. That means immediately seek treatment if they are ill. Give them that psychological support, and to stay in touch with them. So the important thing is to make them understand the situation, explain it to them. So maybe the older people, the elderly people don't really read as much, see as much, or understand. So the family or the caregiver really needs to sit down and explain this whole situation to them, so they do understand what's going on and they understand what's being done for them. So we say, why vaccinate the elderly? Because the data is telling us that they are the most likely to be severely ill. The CDC has noted that 8 out of 10 COVID deaths has been among adults. That's in the US. And severe illness means that the person with COVID-19 may require hospitalization, intensive care, or a ventilator. And this is what we don't want for this group of people. So you ask the question, is it effective then to vaccinate the elderly? Well, a study done in the US also shows, this is in a nursing home, it shows the reduction of cases among the nursing home residents, right? And you can see that the effectiveness is clearly seen. And these are individual studies. We don't have one big overall study, but it's clearly seen in the individual studies, right? And the deaths in the nursing home also significantly reduced. Look at the gap. It's such a big gap. The deaths have reduced tremendously. So the next question, is it safe to vaccinate the elderly, right? People said a lot of things, it will lead to myositis, myocarditis, death, and every death was being linked to COVID. Well, just to be clear, For the deaths that we found, I know many of you have heard the news that there were brought in deaths, people found dead at home. The reason why they died was because, to be frank, they weren't able to come to the hospital on time. Some left it too late because when they first get some mild infection, mild symptoms, they say, oh, never mind, I'll see how I am tomorrow, day after. And then they come to a point when they just cannot get up or they just cannot go and it's too late or they can't call anybody on time, right? And in general, we've done a lot of clinical trials and it shows that basically it's mild to moderate severe adverse events. And it's usually self-limiting, meaning the adverse effects will just go off on its own, but it's not so prevalent in the older people. And serious adverse events are very, very rare. And honestly, we haven't proven anybody or proven any case of death to be directly due to the vaccination. However, we don't put it past us that it can happen because some people can get a severe allergic reaction and it can happen to anything, to an antibiotic. It can even happen to your tetanus vaccination. You take a tetanus once in 5 years or once you've taken a tetanus, it lasts 5 years, so to say, if you're exposed to injury where there's rust or soil and so on. But you don't think twice, the doctor will say, hey, you fell down, you've cut yourself on the rusty tin, go take a tetanus. How many people stop and ask, hey, is this safe? No, right? We just do it. So yeah, so it's a lot of perception here as well. And the phase 2 trials also showed very good antibody response for the elderly. And actually, there are some unpublished phase 3 analysis that suggest high efficacy of prevention in them. Common side effects you will get on the arm: pain, redness, swelling, and throughout the rest of your body, there's tiredness, headache, muscle pain, chills, fever, nausea. Some people felt a lot of body ache and were unwell for a few days, but that seems to be what a lot of people are actually facing. Now, very important point to note is when an older person gets vaccinated, they must be monitored for 72 hours after the vaccine is given. So when I say monitored, means they don't need to be admitted or, but they need to be checked upon for the first 3 days. Look to see if they have any shortness of breath, any skin lesions coming up, you can probably see some spots on them getting bigger, maybe severe pain on the injection site. I mean, we all get pain and you can take some paracetamol, Panadol and so on, but if it doesn't subside, the pain gets worse. There's fever, and after the medication or the antipyretic or Panadol, the fever doesn't go down, it doesn't subside. They still can't eat. Their oral intake is poor. They're vomiting, they have diarrhea, they have confusion, then it's best to bring them for an assessment. It may or may not be related, but it's important to note that these first 3 days, some monitoring should be carried out. So I very quickly touch on frailty. I just have a few slides here because I think it's very important. So what really is frailty? So frailty is actually a geriatric syndrome, a syndrome among the elderly. It's very dynamic, okay? And it can fluctuate with time. It's not the same for everybody. Some get it, some don't get it, some get it, but over a period of time, it actually reflects a dysfunction in the system, multi-system dysfunction, affecting different systems, physical systems, social, mental systems. It reduces the individual's resilience. They are not able to stand up and fight and do things, and may lead to increased risk of experiencing adverse health outcomes or even death. And this state of increased vulnerability to stresses due to age and disease-related deficits can accumulate across multiple domains, as I said. So what is important is when one becomes frail, there will be decreased mobility. There will be weight loss. You always notice their weight loss and their skin starts sagging, decreased muscle strength, decreased energy levels, and or even decreased activity. But what is so important is that frailty is not because of simple aging. See, frailty actually occurs because of certain factors such as socio-demographic influences, people who are living in poverty, living alone, low education level, maybe they have some psychological factors, depression, so they don't eat, they don't take care of themselves. They may have nutritional issues, so they have malnutrition, or polypharmacy. They're taking a lot of medication, but somebody is not managing all those medication. They go and see one doctor, they get given something, another doctor given something else. There's no one person looking into all of it. They may have diseases with complications, or maybe just a low physical activity. Sometimes older people need to be motivated to get up and move. They just, the easy and no need, I'm old, I'll say. but they need to get up and move. Okay, and that no physical activity can lead to frailty. So it's important to understand that frailty is not synonymous with age or aging. It's the result of aging when factors are not taken care of, or preventive factors are not being taken to prevent frailty among them. But the risk of having frailty can increase with age. It's not synonymous, but you're at a higher risk of developing frailty. And unfortunately, when frailty is present, then there are poor outcomes. Your readmission rates are high, length of hospital stay might increase, mortality rates are higher, they might have to be discharged to another institution other than home. The patient may report new disability, and there's increase in healthcare utilization. So this is something that needs to be taken into consideration. Sometimes it's not about being strict or mean, but getting them to move, getting them to be physically active, mentally active, working on things is very, very important to keep them in the best of health. As far as possible, we want to avoid frailty in the elderly. And just to share with you that we have this clinical frailty scale. This may be carried out by any medical practitioner, where it ranges from very fit to terminally ill. Okay, that's 1 to 9. And based on the scale, the geriatricians actually do recommend the vaccination. So what I can share with you, you can see that 1 is very fit, managing well, and then it goes on living with frailty, living with moderate frailty, severe frailty, very severe frailty, and eventually terminally ill. So they did come up with some recommendations for elderly persons, so that if they're in the clinical frailty score of 1 to 5, sorry, I wanted to go backwards actually, 1 to 5, which is very fit to living with mild frailty, then we say we encourage vaccination, of course, consent by patient, family, and so on. Again, here we're talking about the frail people and not just elderly on their own. And then if they are within the frailty scale of 6 and 7, meaning living with moderate or severe frailty, then we say if they are unwell, don't give the vaccine, defer the vaccine. But if they are well, we encourage the vaccine. And then there's those with clinical frailty scale of 8, which is living with very severe frailty. And for these people, and if there's signs of active dying process, sorry, because that's the medical terminology. It sounds very crude to say dying process, but that's the terminology there. Or if they have complications of diseases not responding to treatment, we defer the vaccination. If none, we encourage the vaccination. And last but not least, if you look at those who are terminally ill, that's your clinical frailty scale of 9, with an estimated life expectancy of less than 1 month, then we defer the vaccination. But if the estimated life expectancy is more than 1 month, we encourage the vaccination. So this is something that's drawn upon by the geriatricians also to assist in the vaccination of this particular group, the frail group, which is different from the other group of elderly who can, who are still fit enough, who can still come, get their vaccinations and so on. So even in the frail, we understand that there are problems. So there could be communication barriers. They may not be able to understand. They may have aphasia. They can't speak. They may have a cognitive impairment. They can't understand. They may have atypical presentation, change in behavior. They don't eat well. So again, these groups or these people or this group of people need to be monitored very, very closely for 72 hours after the vaccination. So in general, I've come to the end of my basic presentation, but before I end, I would just like to say it's important for the elderly to maintain the 3 pillars of prolonging a healthy life, have a good balanced nutrition. They will need proteins, more proteins, have the sufficient number of calories per day. A lot of vegetables are very important. Exercise, meaning physical activity, is very, very important. Just walking makes a lot of difference. Social activities, talking to people makes a lot of difference. They should not be just sitting and, winding their time away. They need to talk to people. I mean, now, whether it's through digital media or meeting people, they need to have some social activity. But now with COVID, you can't meet people, at least digitally or by phone. You must talk to them, get them to, do things, read things. It's very, very important. And of course, their social participation is there. But again, accordingly, as I said, where the situation is correct. But all this actually helps them to actually live life better and healthier. And it's very, very important for these people to follow the precautions, right? Wash their hands, cough and sneeze into a flexed elbow, use disposable tissues, clean and disinfect their frequently touched surfaces, follow distancing measures, and avoid unnecessary public activities. You can socialize by the telephone every day with friends or family. This is very, very important for the elderly people at this point of time. So with that, I'd just like to end by saying, don't let COVID win. You know, you need to observe your preventive measures, take care of your health, take your medication. If you're diabetic, make sure you take care of yourself. You know, many elderly have this perception of, okay, I'm going to go for my blood test now. So next week is the blood test. This week, I won't take anything sweet. But then you're conning yourself. You know, it's not about doctor, you're actually conning yourself, you know, because we can do a test, a longer test that tells you your overall sugar control. And we know, because I've seen cases of Dr. Today I ate mangala, mango, yesterday I ate durian. But hey, it's fine once in a while, but you've got to control, manage your pressure, manage your sugar, you know, take your vaccine when necessary, and importantly, seek treatment early if ill. Don't wait, because that's where the elderly always succumb, because they wait just a little bit too late and then you can't do anything. So before I end, I really would like to acknowledge very much this wonderful work by Penny and Jasmine. Thank you very much for coming up, for being the founders of this amazing series.
You have that on your slide.
Yes, you all are doing a fantastic job. Congratulations.
Thank you.
Very proud of you, Penny.
Thank you, Dr. Priya. Thank you.
Thank you very, very much. And I end by saying, please stay safe and stay healthy. Thank you once again, ladies and gentlemen.
I'm not letting you off the hook yet, Dr. Priya.
No,
You're going to stay on board for a while more, but thank you. Thank you for such a fantastic session of and for explaining, for giving such detailed explanations, of course, backed with data. I think data is very, very important, because if we are going to be dealing with something that is so, we're dealing with an unknown, something that we are not familiar with at all. And I think what we can depend most on is definitely data. Data is all we have, okay? And data is what is going to, like it or not, keep us safe, yeah? But we do have a few questions here for you, and I'm going to pick it off the chat and ask it to you. So I've kind of like, for those of you who have questions to ask, please go on the chat and type it in. But let me just summarize it so that Dr. Priya can just be focused on giving us some answers to this. Of course, the question, the most prevalent question of them all, can we mix vaccinations? Many are worried about having adverse effects to vaccination. And someone else mentioned this as well. We know that the vaccination is supposed to be voluntary basis, or is it mandatory? If it is voluntary, then why are we changing the MySejahtera status to incomplete? You know, how is this going to affect us? And the last thing that I put here is, do I have a choice to choose what sort of vaccination, the type of vaccination that I want? I mean, could it be a Pfizer, Sinovac, my booster shots? Which should, can I choose my booster shots? These are three questions I've put together for now. So maybe Dr. Priya, would you like to enlighten us a bit?
Okay, so thank you very much for the questions. So the first question being, can you mix vaccinations? Am I right? Well, in general, no problem. So a lot of research has been done on what we call homologous vaccination or heterologous vaccination. So homologous means you use the similar type of vaccines, and heterologous is you mix. So the vaccination for COVID, if you notice, was very based on the vaccine that was produced first, later, and so many people question this. Okay, but we did find in terms of efficacy that yes, the Pfizer was better. And also we do find in comparison, Pfizer better, as I said, slightly better in terms of efficacy. So what has been done is a lot of research has been done to see how these vaccines react with each other. And so far, the vaccines do not react with each other to cause you side effects or bad effects. But the reason why we give recommendations of vaccines, if you're going to mix vaccine, is we want to enhance the immunity. So what we are doing is enhancing the immunity. So like we said, if you take a Pfizer and a Pfizer, if you remember the chart I put up, that's very, very important because it gives you the maximum. immunity. If you take Sinovac, and Sinovac, it's going to be slightly less. But we find that if you take Sinovac, and Pfizer, it increases the level, right? So that is the reason why these recommendations have been brought out to assist people. And then again, of course, we do understand in Malaysia, it's generally now we only have the Pfizer, the Sinovac, and the AZ. So we are actually playing around with these three. The others are there because there are people who travel and people who live overseas, coming back, going back, and so on and so forth. And many have received different types of vaccines overseas. So that's why we have a slightly more exhaustive list. But if you were to look at Malaysia per se, that is the recommendation. So you can mix, it will not cause you any problems. But it's about whether you get a better effect or a less than better effect.
Yeah, I had my first two Sinovac, so I went for my third one. I took a Pfizer. I was given a Pfizer, so I mean, I'm okay. I think I reacted more to the Sinovac than I did to the Pfizer for some strange reason. Yeah. Okay, but very good. Thanks, Dr. Priya. The other two answers, let me just do a quick recap.
Yeah,
mandatory or voluntary, and the options in the MySejahtera app.
Yeah. So initially, we said when we vaccine, we'll keep it voluntary, let people decide. But as things progressed in the world, we realized that there was a real need, an inherent need for vaccination. And that's why it's sort of like, I would say it's not put as mandatory by law as in you have to get vaccinated, but it has been put somewhat mandatorily as one of the preventive measures, because there are many laws. Okay, the difficulty we face is although everybody thinks, oh, the public health, our Infectious Disease Act, yes, it superseded everything, but we still have to be in line with every other law in the country. So it's very difficult when you want to come up with the law and you can't just amend accordingly as you see fit. But sometimes they sit under certain regulations. So for us, we have a regulation that preventive measures have to be taken. And of course, it's not written in there that, oh, the preventive measure consists of, A, B, C, D, E. It's preventive measures. So it's preventive measures as deemed necessary, as deemed important at that point of time. So when you do that, so inevitably this becomes a requirement, and that's why in the MySejahtera it's there. But then we do face this group of anti-vaxxers, so to say. So in order to try and handle all of this in a better way, we didn't come out and say, okay, anti-vaxxer, we're going to catch you and put you in jail. Because if we make it mandatory, that means for every person who doesn't take their vaccine, we have to throw them in jail. And we don't want to do that either. I mean, we have to balance things out for people. So we have to take things into consideration. So that's why it's not that sort of mandatory, or else everybody else will be in jail. We just say, do it. If not, you will not be able to enter the shop. You will not be able to go places. But for the booster, we zeroed in on the fact that those with Sinovac 18 years and above and those elderly really need it. They need to be protected. So in a sense, it is mandatory, as in your MySejahtera status will change. So indirectly, you can't do things rather than being too gung-ho and catching people. We don't want to do that. We do understand people. Yeah. So that's the explanation actually about the mandatory and the or they have a saying in Malay, right? Paksa rela.
So, yeah.
Something like that.
Okay, so it's the word mandatory is used simply because we are advising that people should go for boosters. If they say that you have to do it, then it's equivalent to throwing people into jail, right? If they were to do it. I'm also once again reminding you guys to mute your microphone, please. Okay. Let's take a few more questions here. Wai Chin Yang asked, is it true that folks with heart condition cannot take the AZ vaccine?
Okay, but actually we did not find that. There's a lot of talk because there was this thing about the myocarditis, and in reality that actually came about in September last year, but I see now that those messages are still circulating around. So when booster came about, then the same message came back. But there has been some evidence, rare cases of myocarditis, but not specific to AZ per se. And yes, in certain countries they faced these problems, but again, we do not know the explanation very clearly what happened in that country. And there are some hypotheses, but we can't say for sure whether that's the reason or not. But we have not found so in Malaysia. There have been people, many people have taken AZ, and people with heart conditions, and nothing has happened to them. So
Okay, okay. So you see, the thing is that with globalization is that, now without borders, right? Everybody can listen to everyone having their say in things, and
yeah,
I think it's just like, too many cooks also spoil the broth, and in this case, too many people talking at the same time also confuses us. So
yeah,
sometimes it is difficult when we don't get the information proper, and plus that on top of it, plus our worries. But I think today you've kind of like nailed it, talking about the dengue and things like that. I mean, look at how we are like with mosquitoes these days. It's really like we're
yeah,
living with it. I mean, and the thing is that nobody thinks twice about having to go for a booster jab for their influenza every year. But yet
yes,
with this, it becomes such an issue.
yes,
And once again, my dear friend Mrs. J has also said, right, we need to keep moving, keep ourselves healthy.
yes.
And I think she was one of those who say, I want to get my booster so that I can go and play. I think she's one of the people who will say that. Now, one more question here.
Yeah.
Car Kid asked, for children aged 12 to 17, do they need booster jabs?
At this point, so we go by priority. Priority actually as in who are the more vulnerable. So because initially we found that the children were the less vulnerable actually. It was the elderly that were affected, those with chronic diseases, and the adults as compared to the children. I'm not saying they are not. There have been few cases, but very, very few. So we would advocate, but all in due time. So you see, as I showed you the statistics, we haven't even actually achieved 100% yet, right?
Yeah, yeah.
So we are going accordingly, but simultaneously we started the booster. So we go for the vulnerable first and see what happens. But now we actually have opened out actually 12 to 17, and they have been going and taking, and they can take.
For the
Um,
booster jabs too?
yes, for the booster as well.
Oh, okay.
But it is not open for all. So maybe
Okay.
if there's children in this group who actually have an illness or they are more vulnerable, then they can take. Okay. So,
Okay.
but for now, it's more of the adults on with the Sinovac and the 60 years and above. But they can take. I mean, that's what I'm saying.
Okay. All right. Now, there is one more question from Fazlan. He knows that he should get the booster. He has received his AZAC,
Mhm.
but he would very much like to have AZAC again as the booster. But my Sujatra does not give him that option. Can he do something about
Ah,
that?
yeah. So now, right, we are not depending so much on government PPEs for vaccination. It's private PPVs. So you can go there. So currently what they do, the private PPVs, is they allow you to go there and make an appointment. But then what had happened was people started crowding. So they went back to My Sujatra. So, but My Sujatra will not give you that option, but you can contact the location or the PPV that you have been given and ask them whether they are providing you with that vaccine. If you're not, you can actually look at another PPV that's providing, and then if you want, you can request them that you want to get the AZ. You can do that because you're AZ, and you want to get the AZ. Of course, the recommended is Pfizer, but if they have the AZ, they will give. So it also, unfortunately, will be depending on availability.
Okay. All right,
Yeah.
cool. So basically, Fazlan, to answer your question, you can actually call up some other PPVs to see whether they offer the AZEX there. However, I've had friends who actually they have actually done that, and they managed to get the vaccine of their choice.
Yeah.
Although the doctors were highly prescribing pushing them towards Pfizer to get Pfizer, especially when they had Sinovac or AZAC before it.
Yes.
One more question.
Sure.
How necessary is it for seniors with no comorbidity to have booster shots, and if they seldom go out?
Okay, so firstly, a comorbidity can actually develop anytime. So we can always think that we're fine, and suddenly we might get it. So you do not know when you will get it, and especially if you're a senior. And seniors also receive visitors, family,
Yes.
friends.
Yes.
So even though you don't go out, people come to see you. And the
Yep.
tendency is there actually for people to not wear their mask. when they're seeing their families and their friends, right?
Well, that's the thing. You don't know who's coming to see you and where they have gone to, right? Where they've been to, and so I think it's just for necessary precautions.
Yes.
Be vaccinated and stay safe, right?
Yes.
Yeah. Okay. Well, if no one has any more questions, we would actually move on to something else. I think Dr. Priya, that was a fantastic, enlightening talk from your side, and I think we have learned so much from it. As for the slide on the efficacy of the vaccines, I will share it over the Telegram on Facebook as well as all our Instagrams and all. For those of you who have not liked Amazing Seniors on Facebook, Instagram, and all the grams that we have, the telegrams and all, please give us a like, follow us, do whatever you want, stalk us if you want to, because we have got a lot more coming your way. We're going to arrange and curate a lot more events, a lot more sessions, okay, to keep you guys entertained and to keep you guys learning and to make sure that you know what's going on around you. Dr. Priya, thank you so much for your talk. Once again, anyone else with any other questions? Last, one more question.
Yes, my question has not been answered.
Your question has not come in the chat, Mr. Lau.
Okay.
By the way, Dr. Priya, that's my father.
Doctor, can I just ask? I used to have
if I may call you uncle.
Sorry, doctor. My question is, I used to have yearly vaccination for flu.
Yes.
So with the vaccination, I'm fully vaccinated with booster last month. So can I still continue my flu vaccination, and will there be complication if I do?
Yes, very good question. Thank you for that question. Yes, you still can take your influenza vaccination. It will not cause you any complications. Because the influenza is different. That is the influenza is a virus that you're facing. It's not a SARS-CoV virus, so there's no issue there. Yes.
Thank you, doctor.
You're most welcome.
Okay. All right. Thank you very much. Thank you very much all for this incredible session. Please stay tuned. Please stay on because we have the next talk coming up in just about 1 minute. Dr. Priya, thank you very much. Is there any last words that you want to end your session with? Anything else you want to add on?
Yeah, I think everybody's doing a great job. Just keep at it. Try to weed out fake news from real news. Don't get emotional about news.
Yes,
just
that is very important, please.
Yes, authentic sites. Go to the authentic sites and try to get authentic information. If you're not certain, just write in, ask, or, we are there to help at any time. So importantly, keep fit, take care of yourselves. Follow the precautions that you need to do, and good job. Keep it up, Amazing Seniors. Great job.
Thank you so much. Yeah, on that note, on
yeah.
what Dr. Priya said, actually some of you have taken to messaging us on Facebook with regards to certain news that have come out, and we have tried to bust certain myths for you guys as well. But keep the questions coming, keep the talk going. We love discussions, we love conversations. Thank you so much, Dr. Priya, and it's so good to see you again. And we are going to yum cha soon, okay?
Yes, definitely.
With mask on, okay?
Yes, with mask on.
Okay, over to you, Derek. Please, Derek.
Thank you very
over
much.
To you.
All right, thank you so much. Thank you so much, Dr. Priya. Yeah,
thank you so
much.
Priya.
Yeah, thank you so much, Dr. Priya. Thank you, Penny. Dr. Priya, for such an enlightening session on vaccinations and boosters and all anything to do with the vaccinations. And Penny, for your inputs and for the questions. Thank you so much, Amazing Seniors, for your questions that you have thrown to Dr. Priya. Now, moving on. Before we move on to the next speaker, just a short reminder for the lucky draw. Please fill up your details in the lucky draw form provided in the link in the chat forum. And also a reminder that we are giving away 2 invite passes to a reunion special Chinese New Year dinner and performance at Berjaya Times Square on January 29, brought to you by us, Amazing Seniors, and the Giving Bank. All right. Now, moving on, we have a very distinguished person that was going to speak to us about caregiving services. Her name is Balvinda Kaur. She is the Homage Head of Business Operations, and she's going to give us a brief introduction to Homage and their services, how they have helped seniors via vaccination escort. They escort you to the vaccination centers, to the PPVs, and post-vac care, all right? And how participants can also join Homage as freelance caregivers. Now, just to give you a bit background about Homage, Homage offers holistic home care solutions, all right, covering personal care, nursing care, medical escorts, and home therapy. In today's pandemic environment, which we live in right now, all right, and hopefully it becomes an endemic, I'm praying for that seriously, Homage can offer you vaccination escort as well as post-vaccination care for those receiving their vaccinations, first and second doses, and the booster jabs. So without further ado, let me introduce Balvinda Kaur, Homage Head of Business Operations, who will now share insights about home care, Homage home caregiving services. Over to you, Balvinda.
All right. So, hi, everyone. You can just call me Belle. I find my name sometimes quite a mouthful as well. So, thank you so much, Derek, for the warm introduction. And thank you so much, Dr. Priya. I think coming in, sitting in the session from Dr. Priya and, segmenting into my section, I really hope to be able to also, connect the dots and how we at Homage really want to, echo the message that Dr. Priya left us with. Stop COVID-19. We all play a role. Vaccination, yes or no? And how can we go about it? Yeah. So an introduction about Homage is simply we are a home care service provider. So yes, our biggest clientele is seniors, but we also play a role where we do assist adults as well, whereby most importantly is we want to be able to provide care at the comforts of your own home. So this is so important because there's no place that is better at home. And we do also want to factor in, your primary caregivers, your families who certainly play a role in making sure that your entire environment end to end, from physical to even social, is also looked into it. So on our end, the people who conduct care are what we call care professionals. And as mentioned by Derek, so this is a combination of caregivers, nurses, and therapies. So a quick introduction about caregivers. So caregivers could sincerely even be people like myself, where I may have sort of an informal caregiving experience through my personal experience of looking after my late grandfather, or even my uncle right now who has Parkinson's. Or on our platform, we take a lot of pride where at the end of the day, we do look into a lot of training and making sure that they are skilled to be able to provide both quality and holistic care. Now, Homage is currently already operating in 7 locations. So we started off our operations in Kuala Lumpur and Selangor. We then went to Penang. We're already in the southern region in Johor Bahru. We went back up north in Ipoh. And we've recently started our operations in the Borneo side, where we're currently in Kota Kinabalu and in Kuching. So we certainly hope to continue to grow, to be able to reach out to so many other families out there who truly would require help at home. Yeah. Now, on the Homage end, right, we use this term called the Homage solution. We call it using an app. But in simplicity, for smart technology, what it really means is that on our client's end, for example, and our clients here could really be children, wanting to get help for their parents, for their own husbands, for their own wives. So the app functions as simple as, wouldn't you want to know who's coming, how they look like, what's their background? Yeah, and this is where we will be able to provide continuous care, because maybe today I'm coming in to provide care. 2 weeks later, it could be a different person. So this is very important on our platform to ensure that we provide visibility to family members, including family members who may be located overseas, because they too are very interested and very invested in ensuring their loved ones gets proper care. And similarly for our care pros, they too uses our app to be able to do what we call real life reporting. And the app also enables them to, continue to take conversations outside of the care environment. For an example, about finding out more about how was my mom during the visit. All of this sometimes goes into a conversational mode between families, for we encourage such relationship. Yeah. So now on our end, not only do we provide vaccination escort, which is ultimately our focus for today, we also do provide personal care. So some of the elements of personal care will go back to, providing companionship. We also want to be able to help families conduct exercises at home. We do also assist a lot of seniors and adults in making sure that their well-being is taken care, including assisting them with showering, helping them to get dressed. And essentially also, if at all needed, be night caregiving, where we spend the night with the family just to make sure that surveillance is also provided. On a nursing care angle, we do get common requests is when we have families who have seniors who are on tube care, where it's NGT feeding, for example, catheter care, so respiratory care. So these are all very essential to ensure that continuous care is provided for them. Now on medical escort, so we do play a role where we escort seniors, adults, to ensure that they will be able to keep up to their regular doctor appointments, and also making sure that we play a role where from all the way to scheduling their appointments and keeping to their appointments. And last but not least, we also have therapy services. So our therapy services is also open up to children, but we do evaluate on a case-to-case basis. So we do have occupational therapy, speech therapy, and as well as physiotherapy. So now, coming into the big topic that we're discussing, especially coming from Dr. Priya, vaccination escort. So how does homage play its role is essentially we get in touch with families who contact us and say, I need help, whereby I may not be physically available. I have a family or a loved one that requires to be taken for a vaccination appointment. So the role that we play is that we work very closely with the family to get what we call preliminary details. So some of these preliminary details, as mentioned by Dr. Priya as well, we do want to find out, especially if you have any like underlying medical condition. Yeah. Now, why is this so important? It's because we never know if you may have an effect, right, after the vaccination. So at least we want to make sure that we are well prepared with a bit of your medical background. Now, please bear in mind for all of our audiences, when we talk about medical background, it does not mean you have to have a medical condition. It's not limited to diabetes, stroke. Yeah. Okay. It could also mean simple things like, do you have a history of maybe fainting, when you go for your injections, or even when you maybe take blood, for an example. Yeah. So we even try to go into such of this nitty-gritty details because we want to make sure we are prepared. Yeah. And then we also look into your My Sejahtera element, where we have encountered simple situations where, maybe mixed with a bit of anxiety. That's when the My Sejahtera doesn't, you have difficulties, you can't connect to the internet. So sometimes we also come prepared where we want to just work with the families to ensure that we've actually gotten all the necessary like screenshots. Yeah, this will be so important to ensure that when the vaccination is actually given, ultimately all the way to My Sejahtera, it will be recorded. Yeah, so in the entire process that we do, we deal with different scenarios. We've also dealt with families where they were available to take us, our care professional, along with their loved one, but they were not available to stay through the entire process itself. So we are more than happy, to even, jump in the same car with the family, follow them, we get dropped, and we are there for the entire process. Yeah, but we also will be able to do what we call the pick up and drop off as well, so that we will arrive at the family's place, we'll pick them up, we'll go together with them, we'll drive them there, or at times we even consider taking Grab. So some of you may ask, why Grab? Why not drive? Because these are the little details that we have to take into consideration, especially with our experience when we were, in the PPV centers, the big PPV centers like KLCC, IDCC. Can you imagine dealing with, potentially someone who may be on a wheelchair? And if I, as a care pro, was going to go with a senior, at that junction, Grab would have been a better option. because I wouldn't want to leave my, the person I'm looking after unattended while I need to look for parking and roaming around. So these are the little things that we want to, make sure that it's our way of helping families to ensure their loved ones are able to complete their vaccination in the best way possible, as long as it's also important to make sure that they're very, very comfortable. So in this entire process, during the 30-minute observation, that's very, very critical. Yeah, often enough, maybe again coupled with anxiety, impatience. A lot of people are like, yes, let's go back. I don't want to stay here. There's always, like what Dr. Priya says, that unfortunate events where people claim that they might have gotten also, or maybe even through events, they might have gotten COVID from their PPV centers itself. That's why we are here to ensure that they wait for that 30 minutes. Yeah, it is noted, that some reactions can happen after the observation period, but at least for those who may develop adverse effects, the 30 minutes are so critical, because then at least the doctor, who will always be, available doctors and even nurses on standby at every PPV center, including private PPVs, will be able to give what we call immediate medical attention. And this will be so, so important, not just for us, but for the care recipient, as we call them, because then this will influence on the kind of post-vaccination help or care that they need. So on our end, once the whole vaccination process is all done, we follow them back home again, whether we are there to do the drop-off themselves, or whether a family member is actually going to be picking us up. Both ways works for us. And on our end, especially like what Dr. Priya mentioned, 1 jab, 2 jab, now going for the booster, and what's next. That's why this summary report that we provide on our end is very essential, because that's where, if at all there was any reaction, whether it's an allergy, whether they had, they find that they had a bit of difficulties in breathing, will be so important, so that A, the family knows about it. B, in the event that they want to be able, they need to seek for post-vaccination care, these are the details that the family will be able to provide to the doctors or the clinical consultants that they're speaking to. Because these are the little details that is so important, especially if they do have an underlying medical condition as well. Because coming from that talk earlier, different people react differently with the different brands that are out there. So summary reports like this could play a very important role, especially in the follow-up booster jabs as well. Now, coming up after post-vaccination, what happens? So on our end as well, as shared earlier in my slide, because we also do provide, what we call holistic care from a personal, we do get families actually choosing to, potentially engage our services primarily just to keep a vigilant eye on their seniors or on their loved ones. Especially if they did develop any symptoms or any effects during the vaccination visit itself. So this is where we play a role, where we work very closely with the families to make sure that if they do develop symptoms such as, low appetite, they find themselves maybe, for some very groggy, then we can always come in to provide them with some form of companionship, some form of check-in, encouraging them to, continue to keep a healthy, regular lifestyle. Yeah. And on some cases as well, we also provide night care, just to make sure, especially during the 48 to 72 hours, that could be a lot more critical in selected seniors as well. Then we are always there to also lend a helping hand to the family. So in the different families that we've worked with, we've been very thankful and very grateful to not just the seniors that we've been working with, for they provide us with such transparency. So some of the situations, like real situations that we have had to deal with, was adverse reactions, where we were dealing with a senior where she had her right arm immediately had an allergy. Yeah, we could see that she shared with us that she had difficulties in moving her right arm. Yeah, so typically in such situations, we understand that people might start panicking, right? So at least we were there to A, provide her with some form of comfort. B, we could immediately rush to the doctors that was available there to get her to look in. And that's where they took into account her condition, and that's where we were well prepared, because we knew, thanks to the family who shared with us on some of the medications that she was already on. So we call it little things that goes a long way. So we strive to work very closely with the families to give us such visibility. Yeah. And these are some of the quick real stories that we would like to share with everyone, where in this situation, Mr. Ng, our care pro, her name was Sui Lian, and we were there to assist his father in the vaccination escort. And this was back in June, July last year, when the PPV centers, the big PPV centers, were really at its peak. And we also have another care owner, we call them Madam Yuet, who had also engaged on our escort services, and she was very happy with the care pro that we sent, and she's also actually engaged some of the continuity services that we've had, part and parcel of making sure that her loved one is well taken care of. Yeah. Now, this is just a picture that we have of our care pro, where they take a lot of pride knowing that they play a very essential role and a critical role in making sure seniors, adults get their vaccination. And we are there to make sure that it's as best as possible, as comfortable as possible, and making sure that they feel they're taken care of. That's very, very important. Now, on our end, I like how Derek and Penny has been, echoing a lot of the freebies. Yeah, so we too at HomeAge have some exclusive promos for all of you here. So on our end, for all of the event participants today, we have an exclusive promo price for you, where if you're interested in our vaccination escort, it's 100 ringgit. Yeah, our usual price is at 120, so it's a discount for all of you here. We also are providing a 5% off of all HomeAge services. So this includes our therapy services, our care plans for all of Amazing Seniors members. So all of this are already on the Amazing Seniors website. Please get in touch with the team from Amazing Senior to find out more for sure. And we're also giving out freebies for the first 10 packs. So in our HomeAge care pack, what's in it? So we have a towel, we have a manicure set, we have a what is this called? A towel, a manicure set, and we also have a stress ball. Yeah. So on the last but not least is, we do also like to share, like what Derek said, on our end, we're always constantly, reaching out to so many different people out there on, wanting to join us purely as the care pros. And we do have senior care pros on our platform who has been such a blessing to us, actually, because they've been able, stories like Jocelyn, who has been able to use her own experience being a colon cancer survivor, joining us after retirement, and so amazing to see her in action. Yeah, where she's our, very noble caregivers, where, post the training that we do provide on our platform, it's just so amazing to see her in action, really being able to use her own experience and applying it to the different seniors and families that she takes care of through our platform. Yeah, and we also have Andy. So Andy is 52. So, he first started joining us because when he was really helping out his mom, he felt that he learned so much, from communication skills to techniques, and undeniably a lot of patience. Yeah. And when he joined our platform, he was so eager to be able to use that experience and extend it to the families that we have. So we're so grateful for such care pros, is because joining us is a choice, and seeing them so much of love and time that they put in. Wow. I like what Amazing Senior has. Life begins at 50. So it's so good to see them, not putting a pause, not just because of their age limitation, but really going to the next step and providing care in the best way they know how. Yeah. And we would love to share with everyone that, if you are interested, you can always contact us directly through our website, or always find more about us through Amazing Seniors. Yeah. So with that, thank you so much, everyone. Thank you so much to Penny and Derek for this opportunity. And I'll pass the floor back to them.
All right. Thank you so much. Thank you so much, Belvinda, for such an enlightening and caring, I would say, a very caring sharing, all right, with our platform, with our amazing seniors. Okay. Pen, do you want to have anything to say to Belvinda?
Well, I always have something to say. I mean, that's the nature of my job. What can I say? Okay, but thanks, Belle, for talking to us and telling us about what you can, the type of help, the type of care that you can provide from Homage. Once again, I'll open the floor to questions. I know that some of you have asked about physiotherapy and all, and I've taken time to reply you guys personally in the chat group. Yes, I think Homage does offer that, and they will be getting in touch with you soon. On top of that, is there anything else you would like to know a bit more about Homage? And yes, the vaccination, the escort, right? I mean, it's being offered, and you can actually find it on our website, Amazing Seniors, or if you're having difficulty getting online, to purchase that deal, what you can do is that you can always WhatsApp our hotline. Our hotline is manned by a few of our team members, and is being led by Bavita. Bavita is always very friendly and warm and welcoming on the chat. I mean, if you guys have already spoken to her, she is extremely helpful, and she will definitely be able to help you guide you through the whole entire process. Don't worry, it's not so painful. Anyway, this concierge thing, I have spoken to actually Homage before, inquiring them on their services, and it is really helpful. It actually literally takes you from the door to the door of the PPV or wherever you're supposed to go to, and they also make sure that you're well taken care of, and whether or not, I mean, I've heard stories whereby some of these PPVs and medical centers that you go to, they don't even keep you under observation for more than 10 minutes after that. In fact, they'll just say, okay, you're done, you can go off now. But I think what Homage does is that they will actually observe you for a good 30 minutes to make sure that you are okay before they will let you out the door. Yeah. Are there any more questions? If not, then I'm gonna let Belle go as well. And Deborah, if you're online, could you actually put Homage website link onto the chat group so that everyone can just click on it if they want to find out more about the services offered by Homage? Oh, I've also recently learned it's pronounced as Homage, not Homage.
Yes, Homage.
Homage, yeah. Okay, so guys, you guys can actually go click on homage.com.my and find out more about them, about their services, about what they have to offer. And if you guys are interested, if you amazing seniors are interested to get in touch with them for the vaccination escort service, I think it's I think it's a really good deal. I mean, come on, you just think about the amount of money that I spend on just getting on a Grab to go there, and I'm not even sure I should be getting into a Grab at this moment. Just that cost me about $30 over for a one trip or double trip. I mean, and this escort service is about 100 for amazing seniors. I think it's a good deal. I think it's a really good deal if you think about it. Yeah. So, but yeah. Okay. Any questions? If there are none, I think we're gonna do a quick wrap.
All right, then. I mean, thank you, everyone.
I think everyone's hungry, Belle. That could be a possibility because I am.
Yeah,
I got off easy, without any questions.
Yeah.
I have a question, if you don't mind.
There's a question coming from.
Yeah, because a senior colleague of mine told me that about 12 hours after his booster jab, he felt palpitations. The heartbeat went very fast.
Okay.
And he didn't know what to do because he was alone at home. So he tried to keep himself calm, I mean, he tried all kinds of ways to keep himself calm, not to think about it, all that. And then after that, I think slowly, it stopped. So
Okay.
yeah. So this kind of condition, I mean, okay, he knows what to do. I mean, he when some people would panic, you know, and their heartbeat will go even faster.
I think if I'm not mistaken, right, Belle, correct me if I'm wrong. At home age, if we use your service, you will actually keep track of us for a few, even
Correct.
after the vaccination, right? Because it's like a post-vaccination care. You will take care of us for how long again? 72 hours?
Yeah, so that's a good question. So on our end, purely on our vaccination escort, the service is defined whereby ultimately the first step is we'll come to you, get you there, complete your appointment, and send you home. So what happens is then the family is then given the option of if they want to engage our services after that. Why? It is because we play a very important role during that 30 minutes point of view and making sure that, you know, from end to end, you're a lot more comfortable. Now, within the 24 or all the way up to 72 hours, this is where, you know, mandatory, what's must. We want to leave it up to the options as a family as well. So if in the event from the question that we got earlier, where we do find out that the family would like to engage our services right immediately after the vaccination escort, and this is where understanding if there's any underlying condition, that's number one. Number two, we also want to understand from the family of what sort of maybe basic medical equipment that they may already have at home. For an example, we have dealt with people who are on oxygen concentrators. For an example, we've also helped with people who, even without vaccination, they need to monitor their oxygen levels very regularly. So this is where we want to work very directly with the family to ensure that all these are looked into. But again, to make sure that I don't overpromise anything, it's up to the family, because there are some families who will be like, no, I got that, or I think I need this, because especially in unpresented circumstances, you just never know. So that's where we always hold ourselves accountable, but we remind families that we are a complementary system to whatever support system that you already have. Let us know, and then we know how to play our roles accordingly as well. So in the situation, that is definitely a situation that we constantly worry about as well. And if we were in that situation, number one, we would have definitely done is making sure that they're very comfortable. While we wait for in these situations, we will immediately even reach out to going all the way to an ambulance, or if we look at the medical history of the patient, we might make a judgment call by maybe not necessarily an ambulance, but we won't hesitate to go to an immediate nearest clinic, because it is A, not worth the time, B, why put yourself at risk?
Yeah, I think that's the question that all of us are dealing with. Is about why put yourself at risk. I mean, if you're considering to boost or not to boost, to vaccinate or not to, the next question that would probably help you rethink that is why put yourself at risk. I think that's very important. And like what I still remember when I first went for my first vaccination ever. I was really young. It was BCG, right? I still remember the school nurse came to me with this needle and was like, "Are you ready?" And I was like shivering, panicking. And the nurse told me, nah, jangan takut, okay?
Right.
Because the more scared you are, you know, your muscles are like all tightened in a knot. By the time the injection goes in, whether it works, it doesn't work or not, you already be feeling the pain there. So I think a lot of us, right, are ball of nerves when we go for vaccination, because we are dealing with the unknown here. And the thing is that data has been there to show us, to assure us, yet something in us is like triggering all these insecurities in all of us. And I think that's very normal. And that's why when we go for the injection, whether or not the vaccination is good for us, not good for us, well, it prevents COVID. That's the most important thing. And the next thing is that by the time we get that jab, right, we feel the pain simply because why? The muscles are all tightened. Why? Because we're too tense. Sometimes it's just as simple as that. It's just as simple as that. And you know, we go back and say, yeah, got swelling, yeah, painful here, all everything. And I was like thinking to myself, okay, muscle swelling, injection goes in. Of course, there will be pain. There are definitely, you know, adverse effects. Well, yeah, my colleagues were all laughing at me because I'm one of those who reacted to Sinovac. And Sinovac is so mild, and I reacted to it. I started to have allergies and things like that. Then my mom asked me, are you sure you didn't take something that you didn't agree with the night before? Then I realized, oh yeah, it could be that as well. Well, the thing is that we are all dealing with unknown here, and what's important to all of us is that we don't take risk, or at least we try to reduce risk. My insurance father will tell me this is all about risk management. At the end of the day, you weigh out the possibilities that are there. Okay.
Yeah,
So
you are not alone in your Sinovac reaction. My
yeah,
my colleague's cousin, she was hospitalized
yeah.
for a 1 day observation after her first Sinovac jab due to allergy.
Yeah, so that's what I guess homage is here for. I mean, you know, they are trying to alleviate all our fears, our anxiety, and trying to help us out here. But you know, enough of this talk. This is a fantastic, wonderful Saturday. Well, it's now 12:02, so it's going to be a Saturday afternoon soon. So I should leave you guys all to enjoy your weekend right now with all this knowledge, armed with the extra knowledge that now we have. That we have, yeah. I mean, you know, knowing and understanding a bit more from Dr. Priya's talk, and then as well as Belle reassuring us that, hey, there are services out there who can help us. We just need to reach out. Okay, so if you are still having wondering what should I do and all everything, PM us. Once again, like I said, PM us, like us, follow us, stalk us. You know, be on our Facebook, be on our Instagram, be on our Telegram, talk to us. In fact, tell us what is the next thing you want to hear, and we will organize it for you. We from the Amazing Seniors will definitely organize it for you. But I think Jack raised her hand.
Yeah, I just wanted to share my opinion.
Yes,
I mean,
sure.
my vaccination. I had all the 3 boosters already, but I did not react to any of those. I was very normal until the latest booster that I got 1 month ago. I did not have any symptoms, nothing of that sort. So some of them said that it's not good, but I just got in here and got this out here, and I'm just fine. So I think everybody should just go for the vaccination. You know,
Yeah, those who say that it's not good, they're sour grapes. So, no, I mean, come on, you know, to each his own. Some of us react more to things than others, and I think that at the end of the day, it's our body's reaction. It's our. I mean, my mom was terrified about her jab. I still remember her first jab. She was so terrified. You know, I had to call in Dr. Priya because Dr. Priya is on my personal call, right? So I was like,
yeah,
I'm talk to my mom.
Yeah, I'm 64 now. So my daughter was so worried that I may not feel good and so on, but I reacted very well.
Yeah. Don't worry about it. My mom is way older than you are, but if I announce her age right now, I will not have a home to go home to. So in any case, she didn't react to it. She was fine. She was perfectly okay. And in fact, when she went for her booster shot, her 3rd jab, she was really a good girl. With my dad as well, you know, the 2 of them. So guys, I think the biggest enemy we are dealing with right now, the biggest fear that we have today should be COVID-19 and not the vaccination. And I think that is the most important thing. We have to work on this together because remember what Dr. Priya said, 80% immunity also means that we will have a worldwide herd immunity. And that's what we want, because when we have that, you know, then we can look at COVID-19 and laugh. Okay, laugh at all its little spikes and all, and say that you can't harm us anymore. And I think just like what Mrs. J earlier said as well, we have to keep ourselves healthy. We have to be mentally alert. We have to be physically healthy as well. And I think that's very important. Build on your immune system. And I think, you know, life begins at 50. That's all I can say. Yeah. So thank you very much, Belle. I think with this, I want to hand the time back over to Derek. But before I do that, we have got the next event from Amazing Seniors coming up on the 29th this month. This is like a collaborative effort between us and the Giving Bank to put together a Chinese New Year celebration, of which we have invited 40 over folks from the homes out there to give them a really good time. So it's going to be a dinner show. And Amazing Seniors, we are going to give 2 of these invitation passes. We don't have many, so we have only 2 to spare for you guys. So please fill in the lucky draw and you just may win that. Okay, Derek, over to you now. Thank you very much, guys. Thank you very much, Amazing Seniors. Thank you, Belle.
All right. All right. Thank you, Penny. And again, thank you, Belvinda, for such a wonderful sharing. And also, I would like to thank Dr. Priya for her sharing. It has been a wonderful morning of sharing and caring and giving to our platform the information that has been delivered to this morning. All right. And just a short reminder on the lucky draws, as what Penny said, please put in your details. And don't miss out on the Chinese New Year invites, the 2 passes that we're giving away. It's going to be a fantastic night. And, we're looking so much forward to that coming event. And we are really excited for that event. And, stay tuned for more information for that Chinese New Year event. So
one more thing. Sorry, Derek, I need to interrupt. For those of you who have friends who are interested to catch this morning's show, or rather this morning's webinar, please go on our Facebook or our YouTube. It will have all the videos in there. All the informative videos will be there. In fact, our launch videos have already gone up. So there were many of you who have asked because you have missed out on our launch, and we had very, very informative session there, from will writing right through to caregiving, and I think it will really benefit a lot of you. Please, go to our YouTube, Amazing Seniors on YouTube. We are on YouTube, and we're going to have a lot more events. Also, the Chinese New Year, it may not be live casted. That depends on really our sponsors, but do join us, okay? Derek, sorry.
Okay, no problem. Thanks a lot, Penny. Thanks a lot for the input. And with that, I would like to thank everyone, all of you on the Amazing Seniors platform, all you guys and gals out there for tuning in this morning. All right, really appreciate. Vanakkam, thank you so much. And with that, Going Choi to everyone. All right. Regardless of race, creed, and gender, all right, and that kind of thing. Happy New Year. With that, we will end the session right now, and with a big thank you to all of you who joined us this morning. Thank you so much. God bless.
Bye-bye.
Thank you. Bye-bye.